Okay, good evening, everyone. Welcome to all the familiar faces and the new ones. Welcome to Swissnex. My name is Brendan Karch. I am the interim CEO here at Swissnex, and it's delightful to have you all here this evening. For those of you who don't know Swissnex, we are the Science and Technology Consulate of Switzerland in Boston and New York. We are part of a global network of 6 science and technology consulates, connecting Switzerland and the world in education, research, and innovation. We do projects in many scientific areas as well as connecting startups, and particularly in our 3 main focus areas, which are health and biotech, quantum technologies, and then the reason we're here today, climate and sustainability. So we're very excited to be able to have you here today for Climate Extremes, Planetary, and Human Health Under Stress. A little bit of background. Some of you might know that there is a big conference, science conference going on this weekend in Boston, the AAAS, also known as the American Association for the Advancement of Science. And this conference is really a great place to sort of take the pulse of science as it relates to policy and to science communication. And from what I've heard so far, the conference is just opening now. You might know the pulse of science these days is filled with some level of uncertainty, particularly in the United States. But one thing that is certain is that the science is moving forward, and even though we may be uncertain about some things, we are very certain about the science of climate change right now and the effects that it is having in terms of many, many aspects, which we will discuss this evening. Climate extremes, things like droughts, wildfires, significant rain events, which have been exacerbated by climate change, as well as other things like plastics pollution, which are contributing in surprising ways to the health of our planet. So we have a great esteemed panel here this evening to discuss these things with you. I will hand it over in just a second to them. Before I do that, you might be wondering what these brochures are here. You're welcome to take these home with you this evening. We did a great event last year where we at Climate Week New York City, and we did a collaboration with a climate literacy group called Climate Words, where we co-produced with them this handbook for navigating the fight for the planet. So you're welcome to take those home and share those. I also want to give a big thanks and shout out to the organizing partners for this event. So this could not have happened without the great support of the organizing partners, especially ETH Zurich. For those of you that don't know ETH Zurich, it is sort of the MIT of Switzerland, or as I like to say, MIT is the ETH of America. It is a renowned science and technology university founded in 1855 in Switzerland, and it calls 22 Nobel laureates have called ETH home, including one you may have heard of, Albert Einstein. So we're delighted to have that, particularly Marianne Lucien, who behind the scenes was working on behalf of ETH to make this and the panel tomorrow happen. So I didn't mention this group will be presenting a very similar version of this panel at the conference, the AAAS conference tomorrow at 10 a.m. In Copley. The other organizing partner was the Embassy of Switzerland in the United States, where we had Olivia Gachot, who also worked tirelessly behind the scenes to help make this happen. Olivia is also part of the Swissnex network representing scientific connections between Switzerland and the US. So thank you all for coming. We're going to have just about an hour of moderated discussion. There will be time within that hour towards the end for Q&A, so please gather your questions, and after that we'll have a bit of time for some networking. With that, I want to hand it over to our moderator for the evening, Justin Worland, who is a senior correspondent at Time.
Well, thank you, Brendan, for the introduction and for having me. I write about climate at Time. I'm based in Washington, and as Brendan alluded to, there's quite a lot going on, a lot of things in the headlines that have pushed climate out of the headlines, even as, of course, we're in the middle of a climate crisis, also some sort of extreme data points, whether that be passing the 1.5 degree threshold last year, or just this January being the hottest January on record, even though we're in the middle of a La Nina typically a cool cycle. And then, of course, you can think about all of the extreme weather we're seeing in California, wildfires, or the flooding in Spain or North Carolina. These headlines in Washington are also having an effect on things like this conversation. We lost one of the panelists due to concerns about the administration and what speaking on this topic might mean. So we're going to talk about the science. We're going to talk about some of the questions around communication, some of the questions around policy that are related to all of this. And we have this really great group here to talk about that. I think what I'm going to do is I'll just introduce you very briefly with just a few words, and then allow each of you to talk, giving more comprehensive presentations tomorrow, but just to give a quick 3-minute sort of overview of what your presentations will discuss tomorrow, and then we'll dig into more of a conversation. And again, think about questions for the end, because it's great to get everybody in the room involved. And so I'll start here and just go across the row here with Maria Ivanova, who is a professor and director of the School of Public Policy and Urban Affairs at Northeastern University. Mary Burlick-Rice, an MD and the director of the Center for Climate, Health, and the Global Environment at the Harvard Chan School. And then Sonia Seneviratne, professor and head of the Institute for Atmospheric and Climate Science at ETH Zurich. And maybe we'll just start with you, and we'll come back around for quick presentations or descriptions of your presentation.
Yeah, thanks a lot very much, Justin. So I'll try just to summarize in a few words what I will talk about tomorrow. To make it short, we are in a climate crisis. You have mentioned it. We have had the highest temperature ever recorded, actually 18 months in a row. We have already had 1 year which was about 1.5 degrees, which was the limit set in the Paris Agreement. We have not yet reached 1.5 because this would require several years above this limit, but we are getting there very fast. We know what is the reason for this. It's use of fossil fuels, so it's basically burning of oil, coal, and gas. We actually have solutions we could change, but at the moment it's not happening, and it's having impacts. We mentioned climate extremes, that's the main topic of that session. I will speak about changes in basically droughts and heavy precipitation. For the droughts, there was this terrible fire. I know you have been personally affected in Los Angeles, so everybody have seen the pictures. It was a massive drought that was actually followed by very high temperature, and of course this led to conditions that were basically fostering this fire, and the impacts were massive. The estimate at the moment is of about $200 billion. There were 18,000 structures affected. I already met now 2 people who had actually houses that were affected. And of course, the impacts will continue. And then there are many other examples of such drought event. There is also the Amazon rainforest. There was actually a massive drought, 2023-24. That was actually the lowest level from the rivers in 120 years. And then there were impact on carbon cycle. And I will also speak specifically on this topic. And about heavy precipitation, you mentioned Valencia flood. Everybody has seen the picture with the cars that were basically just shifted through the city. And maybe one thing I want to mention, because I'm a climate scientist, is sometimes I get the question, but how is it possible that this hot temperature leads at the same time to drought and heavy precipitation? And it's really simple physics. We understand it very well. The physics has been there for more than 100 years. Basically, the hot air can take up more moisture, which means that it leads to drying. But then once it reaches saturation, because you have more moisture in the air, this leads to much heavier precipitation. So I will basically speak about this and about what we need to do, especially also some remaining uncertainty, especially related to the connection between droughts and the carbon cycle. That's a topic on which we have worked. We see on global scale a direct connection between the two in observation. We see in years when we have much lower water on continents, we have an increase in CO2. And there's a very strong correlation. And this correlation we see in observation is not captured in climate models. And also what models are not representing is this correlation is getting worse over time, so it's a stronger impact over time. So I would say there are also uncertainties in climate science remaining, but it might actually imply even worse output or worse results. So finally, my last point would be we need to act now. It's a climate crisis. It's not a question of ideology. It's a question of emergency.
Thank you.
Thank you. I'm a lung doctor and an air pollution researcher, and I'm going to be talking about air pollution and wildfire smoke. And I would start by making the point that the sources of air pollution and the pollutants that I'm going to be talking about, fine particulate matter and different gases, have one thing in common, and that's combustion, whether we're talking about the burning of fossil fuels or the burning of biomass in buildings in the case of wildfire. And that's important when we talk about solutions, which I hope we'll get to in the discussion. And an important thing to know about the lungs is they interface with the outdoor air, and those particles that are released when fossil fuels are burned or when wood burns, they're really tiny. And the tiniest particles, less than 2.5 microns, get all the way down into the alveolar sacs where gas exchange takes place. And in fact, they're so small they're invisible. So what we see is often not even the best indicator of what we're exposed to. An important point from a policy standpoint is that wildfires are undoing decades of progress when it comes to cleaning up the outdoor air, and actually Los Angeles is a very good example of that. If you look at LA 50 years ago, the air quality was terrible, and over time, those pollutants have decreased by about 50% during that time period. And when you look at studies, kids' lung health is better. Asthma risk has gone down. Lung function has grown faster as air quality has gotten better. And yet, now we're faced with these catastrophic wildfire events, as we experienced in LA in January. And to put the air quality in context, in Los Angeles on January 8th, the air quality index reached the hazardous range. The concentration of fine particulate matter was more than 480. That's equivalent to smoking 22 cigarettes in one day. And wildfire smoke is complicated because it's a mixture of stuff. I mean, all air pollution is a mixture, but wildfire is especially complicated because it depends on what's being burned and what the conditions of the fire are. And it contains a mixture of little particles that are small enough to get into those alveolar spaces, invisible gases, volatile organic compounds. And what's especially terrifying in the case of wildfires is that, as we saw in LA, when human structures are burned and vehicles are catching on fire and the fuel burns, that releases, that burns synthetics and oils that have been found to be especially toxic when it comes to irritating the airways and cancer risk in some studies that have been done by the EPA. So I've talked a lot about smoke, and I will talk about it more tomorrow. It's definitely bad for the lungs. I don't think that's going to take a lot of convincing of this audience. But air pollution is actually bad for every organ system in the body virtually. Research for spanning decades has found that air pollution leads to cardiovascular disease, heart attacks, worsens congestive heart failure, it affects the brain, increases risk of stroke, neurodegenerative disease, and cancers, lung cancer and other cancers. And it affects the developing fetus, it affects birth outcomes and children's health as they grow up. And how could that be? Because the interfaces with the lung. Well, what we've seen in mechanistic work is that those particles and gases cause irritation at the level of the lining of the lung. And that then has a spillover inflammatory effect that affects the immune function of the body, and it causes inflammation all the way elsewhere in distant places. And that explains the connection between air pollution and so many health conditions. Okay. Well, I would end by making the point that everybody's affected by air pollution, but some are more susceptible than others. Kids are an important group because their bodies are still developing. They actually breathe more air per unit body mass than adults. older adults are more susceptible, and that's probably primarily because of the higher prevalence of chronic diseases. So if you have chronic lung disease, like COPD or chronic heart disease, you're going to be more susceptible to wildfire smoke and fine particulate matter from combustion pollution. Lower income communities, for multiple reasons, not only because they're more likely to be exposed to sources, but they're not going to be as well prepared to deal with those threats when they come. And occupational groups, firefighters, people who drive trucks, people who work in industrial jobs or work outside, are exposed in their line of work. And so I look forward to our discussion when we think about solutions. Thank you.
Great.
Which one should I? Thank you. I'm going to connect these incredible inputs into what we're talking about, because my recent expertise, my recent engagement is with plastics. And we're thinking, what? We're talking about climate extremes tonight. What does plastic have to do with it? Plastic is 98% fossil fuels. That is the origin of climate change. Plastic is fossil fuels. Plastic pollution, you can see it in the macroplastics all around and in the ocean. And then there's the microplastics. Just like what Mary was talking about getting in your lungs, well, microplastics now are in our brains, in our bloodstreams, in 100% of testicles tested, human and canine, in placenta. From conception throughout our life, they're microplastics. So much like what Mary was talking about, the health effects on the human from air pollution, and you were talking about the fires. All of these toxic fumes from the fires. There was a recent article in the Atlantic, When a Plastic City Burns, about LA. What happens when everything around us is actually made of plastic? The polyester that we wear, it's 100% plastic. The polyester fabrics on sofas, furniture, that's plastic. The vinyl flooring or other areas, that is plastic. And we don't think about it. All of the single-use utensils or cups or plates or containers of food that we put in the microwave, that is plastic, but that plastic is fossil fuels with about 13,000 chemicals. I hear the reactions. And that's the question. Why don't we know about it, right? And Justin, you're the journalist, and yes, it's important. Yes, we can make those connections, but we don't know enough about it. And just like we talk about smoke, about cigarettes, Mary mentioned, oh, this is the equivalent of 22 cigarettes smoked per day. And the audience again gasps, oh yes, oh that's so much. But you can quantify that. That is a lot, and these will be the effects. And I just want you to think back of when smoking was not only normal, it was cool. Some of the people in the audience would recognize that time when it was a sign of sophistication that you smoke. And yet, we have learned more, we have gotten more science, more connection between health and smoking, and our attitudes, our behavior, and our policies have changed. There is no way you can get on a plane where there is a smoking section these days. That's absolutely ludicrous, and yet it existed. So I'm going to end here. That's what I'll talk tomorrow about, these connections that we may not think about, but where I will show tomorrow is that art matters. And beauty will save the world. Because it is art that can show us what we're doing, and it is to the environment, to ourselves, but it is also art that can inspire us to create a different vision. Much like that publication on the chairs is the Climate Words, I think environment, sustainability, art will be the next stage of making a difference.
Well, I love that note, and it kind of opens up one area that I'm very keen to discuss, in part selfishly as a journalist, but also because I think it's crucial, which is this communication question. You talk about microplastics. There's been a lot of attention around microplastics for people who read The Atlantic, right, who are engaging in those conversations. But for a lot of people, this is, a sort of a abstract thing. I mean, the same thing with wildfire smoke. I mean, I was there in LA in January, and when neighborhoods are burning down, the people aren't necessarily thinking about what are the long-term effects, what sort of cancer might I get. They're thinking about oh, can I go see my house if it's okay? So how do you communicate the urgency of these things that might seem a little abstract to people? And I guess we could also say this about climate change broadly. So I'd just be curious insights from each of you.
Well, maybe I can start about climate change. I think the essential part is to speak about the solution. So that's what we hear a lot. I mean, when you speak mostly about the problem, people get a bit overwhelmed. And that's actually one difficulty that they might shut down. So basically, they might not be thinking about the solution. Although in this case, now we have a lot of solutions. So I'm involved in the Intergovernmental Panel on Climate Change. I was an author on the last report. And basically, there we have terrible news. I mean, the situation is not good. We are not on track compared to the goals that were set, for instance, the Paris Agreement. But there are also some good news, and that's actually on what we can do for mitigation. So, for instance, if we want to be on a trajectory that will stabilize global warming more or less at 1.5 degrees, which would mean reducing emission really very fast, because every year where we are emit more, basically we have more accumulation in the atmosphere. So the coming years are incredibly important, but actually there's a huge amount of things we can do until 2030. So the report showed that until 2030, we could reduce a large part of the emissions, for instance, by going to renewables, so solar and wind energy. Just by those two, we can reduce emissions by 20%. To be on track to 50%, to 1.5, we need to be at 50%. But those 20% would be very easy, because a lot of the costs now have gone down. Actually, about half of these possible changes would cost less than what we do right now, because we use a lot of fossil fuel, which is very damaging. But in addition to this, we spend a huge amount of money on it. And actually, the alternatives often now are cheaper. So I would say in the case of climate change, I'm not totally depressed. Sometimes people ask me, how do you do not to be so depressed? It's because I know the solution is there. Maybe a bit like what Maria was saying about the smoking. We know if we take the right decision, we can change, and it will be fine. We just need to make this change.
So I'm a scientist primarily. I'm a doctor, but I spend most of my time doing research, and I have to admit the hard truth that people are not motivated by data. As much as I try to convince people, showing my research findings and the graphs and everything, that's not what really motivates people to change their behavior. And it's stories. I'd love to hear more about art. And I think we're at this time point now where we're grappling with that, right? We know we have to change behavior. We have plenty of evidence. On the health side, thinking about solutions, almost every effort that'll reduce fossil fuel burning has health benefits that are so valuable that they exceed the cost of doing whatever the intervention is. And not only that, they're immediate. So they benefit the local community that's exposed to, the coal burning power plant, right? Those stories, I think, the data is there. We need more stories that people can see and hear and say, oh, wow, and hear from the community members on how they feel better when the air is cleaner. I spend a lot of time thinking about the smoking analogy. So studies have shown, actually, this is, I think, kind of amazing, that if a doctor just says, I think you should smoke, not smoke, I think you should quit smoking, it works a non-trivial amount of time. It actually makes a difference. And that's really kind of amazing to me, actually, that just that little piece of advice that doesn't even take that much time in a clinic visit. And there are so many parallels between fossil fuel burning and tobacco smoke, right? They both cause death, they both cause cancer, they're both especially bad for children, and in both cases, that evidence is overwhelmingly clear, and yet vested economic interests have sowed doubt about the science. And in some ways, just like tobacco smokers, we're always rationalizing why we shouldn't quit. And so I don't have all the answers on how to motivate change, but I think it's somewhere in that stories that people can relate to.
I love the point about doctors, just because, I mean, one of the things I always say is trusted narrators. Who are the people that individuals trust? And, you know, for some small, relatively large but small audience, it's journalists like me. But for others, I mean, doctors that is a very compelling trusted narrator. So it's useful, I think, for everyone to think about for whom they might be a trusted narrator, or to whom they might be a trusted narrator. Sorry.
No, that's all right. Okay. We'll go this way on this mic. But that's a really important point. Who is the trusted narrator? And that's where the participation really matters. And so this is something that we are doing in the policy school at Northeastern now, engaged scholarship and engaging with the communities and working on art and policy. And when you bring people in participatory modeling, as one of my colleagues, Moira Zellner, is doing, you have them sit together and draw and yet work with data modeling and a computer. And then people see, if I were to do X, here are the results. And here's how my community will be affected, and here's how your community will be affected. And it matters. As academics, we don't do that enough. And therefore, I'm looking at this space and it's like, oh, this is a perfect space for art and policy and engagement. And on the art piece, I think art is starting to speak to people in different ways. And so on the plastic space, there's two types of art. One is the art from the garbage. And during the negotiations for a new global treaty on plastics in Nairobi, in Kenya, the delegates were met in March of 2022 by this 30-foot tall sculpture of a spigot with plastic bottles falling out. And the tagline is, "Turn off the tap. We have to stop pollution at the source." But you won't put that in your house. Those are plastic bottles, that's trash, right? And you are awakened by that art and say, oh, this is bad. I shouldn't be doing that. But then you need the art that says, well, what can you do? What can you imagine? And that is where I work with artist Innocent Nurunziza in Rwanda, who paints on renewable tree bark. Art that is painted on tree bark. And that bark is taken from the trees, made into a canvas. The trees, ficus and fig trees, are wrapped in banana leaves, and the bark regrows, just like a haircut. And that's a sustainable art. And then he paints these upward spirals or visions of what the world would look like in a beautiful painting of the Nile River, for example, that is as long as this entire space. And that wakes you up. It's like, how can I be better? And that's where we have that behavior change, because it's not just the doctor. It is your neighbor. It is your trusted friend who can say, let's change our our behavior.
I love that. I want to shift gears a little bit. I want to pull on a thread that Sonia, you mentioned specifically this question of uncertainty and some of the uncertainties that you see in your research. And it kind of came up in other ways in all three of your sort of opening remarks. But just this question of how do we communicate about uncertainty? And I guess how should we think about uncertainty in the context of the current state of climate? And so I mentioned at the beginning, January being the warmest on record, and yet we're in the middle of this La Nina cycle, which typically is cooling and is sort of flummoxing people. You mentioned uncertainty in your research. We could talk about uncertainty with regard to understanding the effects of air pollution on all sorts of different organs and different diseases, and we could talk about uncertainty with microplastics as well and understanding the full scope of it. So I would just be curious your thoughts about your research as it relates to uncertainty, but then also how do we talk and think about the significance of that?
Yeah, no, it's a good question. I think in the past, so at the beginning, when there was research on climate change, uncertainty was used as excuse basically not to do anything by those Western interests, which invested a lot of money actually to sow doubt. Actually, there is an excellent book that was written by a scholar from Harvard, Naomi Oreskes, which is called Merchants of Doubt, and actually showed that there was really systematic disinformation campaign in climate change and also for tobacco, in part also by the same people that were paid by the industry to do disinformation, both in the case of tobacco and in the case of climate change. So there was this campaign to sort out. Now we can say we are beyond this stage. The evidence is so clear, everybody is saying it. We actually knew it when I started doing my PhD. We knew by 2020 this will be the time when the evidence is so clear that we are totally outside the noise. That's what we are seeing right now. We are starting to see events of which we can say not only they have been made more probable, but we didn't expect such events to happen without human-induced climate change. They are so extreme that we cannot explain them actually without our influence on the climate system. So we are very certain that there is climate change, that it's us, we are actually responsible, it's emissions which are induced by fossil fuel burning that is responsible. Where we have uncertainty is actually where it goes from now, because a lot of the change that were happening so far were more or less linear. But we know the climate system is not linear, it's a complex system, and you could have at some point some tipping points. And that's where we have some uncertainty. For instance, this feedback between droughts and the carbon cycle is one possible tipping point. And some others are related to what you were saying, like this temperature now in January. So we have had these 18 months. I must say, even among climate experts, people are a bit freaking out. Are thinking, but that's strange. It's been a very long time. We don't fully understand it. It's still within the range where we can say, okay, maybe we had really the margin of what we expected from the climate models, but it's very extreme. We did expect that we would have such a strong increase, but maybe not at this level. And I would say at this moment now, uncertainty is no longer on our side in giving us a possibility that maybe it's not that bad, maybe actually it's not happening. The uncertainty would be about things being much worse than what we expect. And that can be extremely dangerous.
Do you want me to go?
Well, I mean, I would love to hear your thoughts there, but I think maybe another way to frame it, particularly with your work, is what are some of the known unknowns, things that are perhaps most concerning, like in terms of uncertainty with regard to human health and smoke?
Thank you. So no individual study proves anything with 100% certainty. I mean, that's kind of the nature of science, right? We need lots of evidence before we can say something with a level of confidence that Sonia just said. And when it comes to air pollution, the things that are just not controversial anymore, just basically 100% certain that air pollution causes death. And the way we actually discovered that, the beginning of environmental epidemiology was during the black smoke of London when the air quality was really bad and all these people died. And then the air quality got better and people stopped dying. It was really convincing. And we just have so many studies since then, but using different methodologies, like exposing humans. That those aren't for mortality, but for animals. But the human studies show some of the pathways about how it works. And then we have data from all around the world, different air quality levels that show this slope. And there is just no level of particulate matter that is truly safe, in the sense that lower fine particulate matter concentrations outside are always better than higher levels when it comes to mortality risk. The respiratory health effects, cardiovascular health effects are very well established. I would say where there's uncertainty is when it comes to wildfire smoke in particular, because it's so complicated and because the mixture varies depending on what's burning. The amount of pollution varies depending on whether it's flaming fire or smoldering fire. And we look at air quality and we're just looking at fine particulate matter. That's just a concentration of particles. But does that even really tell it, is that really the best indicator of the health risk? Because there might be other things, synthetic plastic components in particular, maybe that's the best index, but we actually don't really know. And then after a fire, there's all this dust and ash on the ground that can be resuspended. There's uncertainty about that. And the third uncertainty I would emphasize when it comes to wildfires is repeated exposure. So there's acute effects. You can look at hospitalizations going up during those events. But what's the impact over time? There's parts of the world that are repeatedly exposed to wildfire smoke, and those cumulative health effects are not well established.
Yeah. Would you like to comment? There's no pressure to.
No, I just want to say very quickly that it's exactly the same dynamics in the plastic space. But people who say there are not enough studies, right? We haven't studied plastic. We now have studied air pollution, we have studied smoke, but because plastic are part of air pollution and of so many different other ways of exposure, that is very difficult at the moment to say that there is a causation between a particular health impact, and also because plastics and the chemicals that they contain can affect so many different parts of the body. So it can be cancer, but it can be lung disease, it can be heart attack, it can be infertility. And there's a whole book written about that, Countdown, about what is happening to fertility in young people these days. So we, in this one hand, as we have talked about both in climate and in other issues, we need more science, and at the same time, but we know what the issues are. And so it is indeed about communication, justice, and how do we get that story out in a way that people might say, well, I don't necessarily need to have the exact causation, but I know what will protect me, and act on that.
Yeah, very well said. I'm going to go to audience questions in just a minute, but I want to hit on the one sort of thing that I led with and is on so many people's minds, which is this context of, U.S. Sort of pullback on climate and just, I guess I'll come to you, Sonia, because we discussed it before, but others are welcome to come in and just to ask, what do we do? What from a scientist perspective, and somebody who's involved in the IPCC and et cetera, what do we do? How do we respond to that? How should we respond to that?
Well, that's a big question.
Big question.
And I think what we have seen is many people are seeing things unfolding so fast. It's difficult to know exactly what to do. But I would say, first stand up for the science. Just say the truth. I think that's the number one. Is basically not allow the facts to be questioned. Stand up for what we know. And it is a difficult situation. I think what we should say, for instance, in the context of climate change, is in the end, not everything is decided at the federal level. And actually, there were many comments saying a lot of the change have started to happen. There's been much too slow. It should be faster. But there are changes you cannot stop because it just doesn't make any sense, even economically. So it's, for instance, I mentioned the renewables like solar energy, wind energy are cheaper. A state like Texas is actually quite leading in this area, even though many people maybe don't really think about climate change or don't want to say that they believe in climate change, but in the end it just makes sense for them to install renewables. So the solution makes sense, and yeah, I think maybe also trying to reach out to those communities. I think what we were discussing with Mary before is thinking about, not specifically in the US, but in part I think it applies to Switzerland. There is a bit of, basically a separation, I guess, between the population living in cities, which tend to be more informed, and people in the countryside, maybe, which feel that they are left out, and try to find some way to be a community again and share this information, because in the end, everybody is affected by climate change. What we are talking about, I mean, climate change, air pollution, plastic pollution, everybody is affected. Everybody is going to be affected in their health, their kids as well. So it's in the interest of all to make those changes. It's not particular interest, it's really the common good. So we find ways to get the message across.
Thank you, Sonia. So I started in my role as the director for the Center for Climate Health and the Global Environment just a few months ago in October. And what I've really been pushing for, and this was before the election, before all the recent changes, is framing our research in terms of solutions and framing our messaging in terms of solutions. So I've done a lot of work identifying problems, identifying health effects, but those same studies could be framed in a slightly different way to evaluate solutions. So in my own work, I'm working on an air purifier trial, but I also think when we're talking about policy, looking at interventions that people can actually do at a scale that can actually be done, whether it's a community or a city, and trying to have, to provide evidence that's actionable, useful. So I think that's one way that we can have change. But I agree with you completely about the cultural shift and figuring out ways to get out of our ivory towers and understand each other.
I think the issue that we're often confronted with is individual versus collective action. And the point is, it's not versus, it's and. And this is where we have been pushed over the years, whether it's recycling or whether it's climate change, is what are you going to do about it? Reduce, reuse, recycle. And then you say, but that's not going to be enough. Or don't drive a car. Or, I don't know. Don't fly in an airplane. Exactly. So many of those solutions, the top 10 things you can do to save the planet. The planet needs no saving. We do, as species. Planet will be fine. It will re-establish itself. But so all of those top 10 things that we're so used to are individual, and we know that's not going to change. And then we go to the collective, and that's what we're struggling with right now is, but when the collective, when the leadership is not there, what do we do? And that's where the leadership from the middle out will be critical. And that is the cities, the companies, and I say now the campuses, because we are both actors in terms of procurement, in terms of what we do, but also in terms of how we shape the minds of young people. And that's obvious now. It's so many different ways, because academia is feeling the push. And so I also feel that we have a responsibility to do something about this, but we have to act as collectives, and we have to inspire individuals.
That's great. Okay. Does anyone have a question or? Great. Okay. Do you want to? Yeah.
Thank you. This isn't so formulated, but I think there are two things I want to say: nature-based solutions, and also trauma and climate change. So in my experience living for a long time in a country that had been communist and was, after the regime change, there was such a strong legacy of water, air pollution, and practices that were completely undermining of a livable climate. And that had to do so much with the way that the population needed to shut down with the pressures that they had undergone in a totalitarian society. And it has taken a long time for that to shift. This was one of the last countries to stop smoking as a regular daily practice.
Can you tell us which one it is?
Czech Republic. And here in Cambridge, I'm thinking about, from the middle out, there's a huge conflict right now. It's like resource conflicts. There's a desire for big development, which is affecting matters of tree canopy, which helps to not only mitigate flooding, but also to give us air we can actually breathe, and cooling and so on. So I'm not sure what my question is, but I do want to somehow move in the direction of green infrastructure, nature-based nature-based solutions at a moment when there's this federal repudiation, like this defiance against policy that would support a livable future in these ways. So I don't know if there's anything you can say about climate and the ways that nature-based solutions are a part of it. Sorry, that's a bit
I will
long,
just
but
say I grew up in Bulgaria, so I know the dynamic that you're talking about. And it is important to have both the individual action and also strive for change in the collective, because it was an area in the world where nobody believed the change will come. Nobody. And yet it happened.
Yeah. Yeah, no, definitely on this point, also the government matters. So, I mean, there needs to be action on different level, also on political level, to make sure that, not too many things happen that are going to destroy decisions that were taken in the past. But to come to the nature-based solutions, I think there are a lot of useful actions that can be taken, but it's important that it's not diversion from the main issue, which is still fossil fuel combustion. So 90% of the CO2 emissions are due to fossil fuel combustion. So it's both basically oil combustion, coal and gas. So it's mostly the heating system. So I mean, you could imagine having a local initiative to say, let's change our heating system. Why not? The Boston area would not have any oil or gas heating anymore. I don't know exactly what is the status right now. Also cars, I mean, it's better to have public transport. Actually, the Boston area is an area where I think in Zurich, for instance, I don't have a car. So here I imagine this is an area maybe you could live without a car or have an electric car, maybe not of one mark specifically, but some others. But no, not that one, but the others, yeah. Yeah, so again, there are a lot of solutions that exist. Somebody mentioned flights. So unfortunately, there we don't really have alternative. It's just basically reducing flights. I thought a lot about before coming here. I combined it with visits to colleagues at MIT and Harvard, and I think for this it was really useful. But for instance, we had an IPCC meeting in Bulgaria this summer, and I went by train from Zurich, so it was 48 hours, but it was worth it. And I think basically the main point is that's one thing I often say about those stories. Again, those trajectories to 1.5 degrees. The first point is halving emission until 2030. So maybe if you think in your life and also in the decision you can influence in your community, if you can diminish basically emissions by half until 2030, that would be already a huge step. Getting to zero is much more complicated, but But then, I mean, trees still would help, and having more trees in cities also helping, but it's not really helping for the emissions.
Can I just ask Mary one follow-up from a public health side, because I think makes total sense on the emissions picture, but to have nature-based solutions, to have trees in your community actually makes a pretty substantial difference for local health, and I just wonder if you might speak to that.
Wow, that was a perfect leading question to what I wanted to bring up, actually, is I'm racking my brain to think of where this was, but in the discussions that I've been having with my colleagues in the respiratory health community, we've been looking for success stories of communicating across the political spectrum, and one of the great success stories is I'll look it up right after this, but it's in a southern state, and it was a nature-based solution, planting trees, offsetting traffic, and there were actual measurable health benefits as a result of that. That paper just came out pretty recently. So lower inflammation in the blood, lower risk of cardiovascular events. There's lots of research on green space and mental health in particular. Green space is good for health for so many reasons, and it's good. It's a place to exercise. It's a place to convene. So I think there's a lot of opportunity here. It's another wonderful example of a win-win kind of solution at a more local scale that can help with climate and also benefits health.
I did notice one right there in the back that was the first.
Hi, so my question was surrounding storytelling and I guess like connecting individual events to climate change, because I think we've seen a lot of success like with storytelling around the tragedies of the LA fires, and that's really mobilized people, and we saw the same thing with the hurricanes in North Carolina, but I think telling stories that connect those two events to get people to understand, hey, these things are both related to climate change, and events of this severity are going to keep happening because of these data points. And so like connecting the data to those stories so that it's not like a one-off instance for the people who are maybe more hesitant to believe in climate change. I'd love to hear any insights on like telling stories in that way.
That's great. Maybe we'll take one more question and then we'll do some answers if that works. And anybody, I don't know. Who else?
I recently read an article, a Swiss news article, on the negative effects of flying, and that the H2O emissions are actually more harmful than the CO2 emissions, and that Germany intends to implement requirements for planes to adjust their altitude so as to reduce the H2O emissions. Do you think it would be realistic to implement that globally, or what are other effective changes we could do to make flying more sustainable?
So, okay, on the first question, I don't know if maybe there's a thought about attribution science, and I think there's an interesting question about attribution science. Oh, sorry. So, in response to the first question, I wonder if someone might touch, Sonia, probably on attribution science and how you're thinking about that, and how sort of the literature is thinking about attribution science. And then I frankly don't know enough about the second question, but maybe you also can take that, yeah.
Yeah, okay. No, on attribution science, yeah, I mean, it's a field that has been developing a lot in recent years. And I don't know if you have seen, but for instance, for the LA fires, we already have 2 studies that have been done. So it was, in January. So there are a group of scientists which try to do very fast, basically analysis when an event happened to quantify basically what is the contribution of human-induced climate change to those events. And there is one group that's called World Weather Attribution that's based in the UK, and actually our group has contributed to some of their studies. And there is actually another European project we're also involved in, and there's another group in France that has developed also another approach for this. So actually in the case of the LA fires, we already have 2 studies showing that the probability was made higher. And yes, I mean, definitely this is, I think, very powerful to get this message across. We were also, in the case of IPCC, we do this assessment, but it's only every 7 years. So one idea was also to try and do something in between, not only after the events, but also maybe every year. So we are speaking about this within the World Climate Research Program to have maybe a retrospective summary. But definitely now we have a lot of evidence, and we are able to make this link showing that some of these events have been made more probable, actually many of them. And actually one discussion I had with colleagues in Harvard was just this week. It was about how to use also this evidence in legal cases. So how do you translate the evidence from scientific studies in a legal context? Because there are also causalities that you can prove. Responsibility is essential.
A few decades ago, I recall that conversations around extreme weather events were very much framed in terms of, well, we had another big storm. It's unclear if this storm was due to climate change or not, which is not really a useful question in some ways, right? We know that the probability of certain events is changing, and the medical analogy that I use is again smoking. So I have a patient with lung cancer. I can't say for sure if their lung cancer was due to smoking or not. But I know that their smoking increased their risk of lung cancer. It's really the same thing. And I do think that as scientists and the journalism field, I think that that is a shift in the way we talk about climate change and events that I've observed.
There, just one little comment from my vantage point. I 100% agree on that communication shift. I find attribution science and studies very helpful. I do have this other interesting sort of observation, which is that a lot of people who are inclined not to believe in the science of climate change in the first place will they'll try to pick apart the attribution studies to the point where I'm just, I'm like, well, this is reinforcing the priors of the people who are inclined to believe it, and sort of giving ammunition to people who don't, which is just to say, I think one thing I've adopted is to dispense with that language of, well, we don't really know, still cite the attribution science, but also lean into making the connections, even in the absence of the attribution science, because we do know, for example, in LA that LA has had a dry spell after a very wet spell, and that's something that we can make that connection even without seeing the attribution science. So anyway, that's my personal opinion and perspective. I don't know if you want to have any take on the second question. Okay.
Yeah, so I think the second question was related to the basically emissions from aviation is not only related to CO2, but it's also related actually to impacts on cirrus clouds. So this depends actually where the planes are flying, and there is actually research looking into this about how you can minimize this effect. So yes, there is research trying to see, for instance, if you have different routes for the plane, this could reduce some of the emissions. This impact is more a radiative forcing effect on the climate system. And in terms of other alternatives, definitely on continental level, I would say taking the train is, I think, an option. 2 years ago, I was doing a sabbatical in Stanford, so close to San Francisco, and I had a conference and meeting with colleagues in Denver. I took the train, but many of my American colleagues thought I was kind of crazy to do this. But in Europe, it's quite common, and you have very good trains. At least my train was very good. I had no problem, so just can recommend this.
I'll add one other thing here as well. Sorry, I'm talking a lot as the moderator, but there's this fascinating research from the IEA on personal energy use, and if you make the easy choices, so not even taking the train from San Francisco to Denver, but I live in DC, I take the train from New York to DC instead of flying, and if everybody made that choice, it would shave off 5% of global emissions. And so even just making the easy choice when you can make a big difference. So, okay, we have time for one more question, I think.
Yeah, thank you for the insight so far. Mary, you brought up the alignment or I guess misalignment between economic interests and these problems. So thinking through shifting economic interest to the solutions, I look to the business community, and I'm curious in your respective fields if you've come across any social enterprises that are making promising progress, I guess.
Yeah, well, maybe I could comment. That's a really interesting perspective because, especially now in the political context, because I mean there is politics, and there is also economy. And interestingly, in this context, the economy is partly move a bit faster than the politics, especially now in the US, if you take the new administration. So I was reading actually some reports that one of the larger banks was actually now providing information on climate change, saying maybe think about divesting in your portfolio. I mean, that's also another way you can have an impact. And so part of the industry, not all of it, some industry, of course, has very strong interest and making a lot of money out of this, by selling fossil fuel or trading them. But another part of the industry and the economy actually was already thinking about the next world and in part are moving forward. So I cannot mention specific actors, but I would say, well, one area definitely is, I would say, in the banking sector. If you can have an influence there, I think, by pushing for divestment. Actually, that's also an area where Switzerland could do much more. And I've also exchanged with different representatives in Switzerland, also from FINMA, for instance, the finance authorities. They had invited me for a presentation. So I'm starting to look into how they can also make sure that what is happening there is not greenwashing, because some is greenwashing, but making sure that we have rules that can be basically followed through.
Well, I'm a pulmonologist, so this isn't exactly my area of expertise, but I really do think, I talked about where we can have impact, and I talked about cities and communities, but the private sector, what a tremendous opportunity for change, right? The green energy revolution is already underway and makes economic sense in so many settings. So I think there's a lot of opportunity as well for academics to exchange ideas with the private sector more. So, thank you.
And if I may, how academics can actually make a difference, both institutionally and personally. We use a lot of what we call swag, right? I mean, how many of you now have bought a Harvard sweatshirt or something, right? And so every university, there's 55 of them in the greater Boston area, 55 plus, would like to create some swag. And as the director of the policy school at Northeastern, people come and say, what is your swag? And so tonight, I'm going to share with our panelists the swag that we give. This is the swag. It doesn't say Northeastern anywhere. And it's an individual set of bamboo utensils that you can make the easy choice, but it might have a collective impact. So you get to choose which one, and you're last. Here you go. But this is the merging of business and policy in academia, because this is a local business that we support. But making a difference does not always have to have your name on it. People will remember.
Oh.
Yeah, well, great. Please, thank you all for coming. We still have networking, so you're free to interact with each other and with the panelists over the next 45 minutes to an hour. So we are so glad to have you all here, and another round of applause for our panelists. The bar is open.